Hey guys, making a reflection for you for my CT Sim rotation. Just reflecting on how that rotation went. This particular rotation for me was it was good, but at the same time I started out a little rough. My first week was not as great as I would have liked it to have been. So I mean, I just felt like I did not perform at the level that I needed to. I feel like I lacked initiative, I lacked energy, and I wasn't performing at my best. So after realizing this, I had a discussion with my rotational staff. We then spoke about how I was not at my best, and I had agreed fully that I was not prepared, that I was not showing the initiative, and was willing to make the necessary changes that I needed to from the end of that first week. So coming in on a Monday prepared, ready to go, understanding that what the schedule entailed for each day, and really prepared for each patient, and sort of thought about different scenarios in which how this patient would be set up, why would it be different, sort of patient problem situations for them that would alter what we do for their setup. Just thinking about where my tattoos or BBs are going to be placed, what sort of immobilization I'm going to be using, if what I should be using if I'm using a wire to unlock a scar, how many tattoos I'm going to have. Am I going to have sweep straightening, imp straightening, or maybe even both? If I'm using immobilization to sort of see what kind of neck rests I'm going to be using based on treatment sites. Just really critically thinking about the scenario itself and what could go, I wouldn't say wrong, but what could go differently than a standard setup for those particular patients. I mean, so assessing, are they going to need IV contrast? If they have IV contrast, what things am I going to be thinking about? What aspects would cause me to have a red flag? Certain things like that, being aware of patient-related issues. So, I mean, if patients have scars, if patients have gastro tubes, if they have colostomy tubes, just really sort of thinking about more than just setting tattoos, thinking about the patient and ways that I can manipulate a particular scenario to get to what I need. And I mean, I felt like I had definitely done that over my last 2 weeks of my rotation. Just really coming in prepared, ready to go, and showing the initiative to get involved with setups. And also sort of getting involved with more patient teachings as well. And that's something that I felt I had proven definitely over the last 3 weeks. Something else that I really sort of took more of a leader role, getting involved with things and sort of talking through with therapists my thought process and what I'd like to do for this particular setup, or things I might want to change, or how I want my straightening to be fixed, or I don't like where my isocenter has been placed. This immobilization isn't ideally what I would like to have, because in some certain scenarios you need to problem solve, you need to create a scenario that works for both the therapist on unit and in CT. So in some scenarios you need to be able to make your back lock as conform to the patient as possible, because there's not a lot of table space laterally, and we need to be able to make ICTH or TTH references. And if we have a back lock in the way and we can't assess that close to our target region, then it's not going to be as accurate a treatment. So those are some things that I feel like I managed to display in my CT Sim rotation. Just having those kind of conversations and really trying to demonstrate my knowledge and understanding, and really having a general prepared idea of what this patient might experience. Some scenarios that helped me would definitely mold room, and having mold room consults with ROs, physics, dosimetry, mold room staff, and really sort of analyzing those situations and what sort of decisions go into what they want to achieve with their treatment. So, I mean, do you want bolus on the field? How superficial is the disease? Is it palpable? Can I find out, based on the size of the lesion, what kind of insert I want to be using? Am I going to be using electrons? Am I going to be using photons? And, you know, what kind of bolusing I want to be using, if I need to be using any bolus at all. Do I want to do Superflab? Do I want to use Vaseline gauze? Do I want to use dental wax? Do I want to use beeswax? Like, there's lots of different opportunities. Do I want to use water? And I mean, just really thinking about all the different scenarios and why they sort of choose the ones that they do. I mean, I asked a lot of questions during those consults and really tried to figure out what their mindset was and what their thought process was, to really understand how they wanted to proceed with these particular treatments. I mean, so having those opportunities definitely allowed me to critically think about how these patients come to unit and how they make the decisions that they do make. And I mean, I was very grateful for having those opportunities. Something else was my other time in mold room was creating a dummy shield for behind an ear. So just a dental wax block to fit into a lateral mask. I helped to construct the layers to accurately represent the lead shielding that was in place after they had changed the prescription or method, so it was no longer electrons, it was a photon treatment. So they didn't need to have the lead behind the ear, which was definitely interesting and fun to do. Something else that I did in mold room was create cutouts for the electron inserts. So using templates 95 centimeters from your head of your gantry source to allow you to get to where your applicator sits. From there, you're going to draw out a foam cutout, and then from there you're going to be using a divergent heated cutting board, basically. What it does, it'll create a slight divergence within the foam, and that will take into account the divergence of the electron beam when you decide to place it in the machine. And from there, the Cerabend is poured into it when the foam insert is in the center of their applicator or their insert size. So I mean, being a part of that was definitely something new and interesting. I knew there was a cutter for it. I wasn't entirely sure as to how it worked. So just a heated string, and with that, having that divergence as well. So that was something definitely different for me to witness and participate in. So I was really happy to get involved with that. Overall, I just feel like I have changed my level of confidence. I always feel like I do after completing a CT Sim rotation. And I feel like I've created a better practice to be able to think about patient setups before they even come to unit. Just thinking about how they would set up, what kind of dosing I would be using, and really trying to use my skill sets from CT into my next rotation.